my name is Bernadette Hohl, and I'm an assistant professor in epidemiology at the Rutgers School of Public Health. I'm presenting evidence and benefits of place-based interventions to reduce violence. I'll start with a discussion of the public health context for place-based interventions. We know that violence is a leading cause of death and disability, both in the United States and abroad. It has serious consequences not only for those directly involved, but the people and places around them. A public health approach recognizes that interventions that address context and environment and social determinants have the potential for greater population-wide impacts. Yet, few examples of these place-based solutions to violence exist to date. Our research in places like Philadelphia, PA, and Camden, New Jersey, or Youngstown, Ohio, has focused on assessing the effects of place-based interventions on violence. These and some of the other cities shown here, as well as many others across the country, share a similar history in that they experienced a significant period of growth and prosperity that coincided with industrialization, followed by a period of sustained job loss, declining populations, and disinvestment, which has led to many of the physical, social, and economic challenges that they still struggle with today. These cities, and in particular certain neighborhoods within these cities, experience some of the highest rates of violence, concentrated poverty, and disadvantage in the country. With declining populations comes an overabundance of vacant and abandoned properties. Youth and adult residents of these communities identify vacant and abandoned properties as not just a symbol of disinvestment, but a contributing factor to the problems that they experience on a daily basis. They've told us that these properties directly influence well-being, physical, and mental health. For example, residents have described that vacant lots attract illegal activity because decaying structures and overgrown lots provide cover for people engaging in illicit activities, therefore creating fear of crime among residents. In fact, research has shown that increasing levels of vacancy are associated with an increased risk of assaultive violence. Wilson and Kelling used broken windows as a metaphor for disorder and crime. Although today they argue that their theory was largely misunderstood, it does inform some of what we think about how place-based interventions might work. They describe the link between disorder and crime like this. Small visible signs of disorder or decay, like graffiti or loitering, can send the signal that a neighborhood is uncared for, creating fear and withdrawal among residents, which in turn results in less eyes on the street. Fewer people outside and engaged in community life suggests that these are optimal places for others to engage in more serious forms of crime, and, over time, because this doesn't just happen overnight, as this cycle is perpetuated, the neighborhood continues to decay. The idea of place-based remediation to prevent violence has been guided by community input, ethnographic evidence, and multiple theories, including broken windows, such as busy streets, routine activities, and crime prevention through environmental design. Essentially, by addressing the source of physical disorder in public spaces, for example, cleaning up vacant spaces or tending to abandoned buildings, we create opportunities for positive social interaction, reducing fear, increasing feelings of safety among residents, and ultimately reducing violence.